The goal of today's show is to share a huge landmark study showing no increased risk of stroke as a result of seeing a chiropractor. Find out exactly what that means on today's show. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. These research reviews, interviews, and episodes are made for you, whether you're a medical doctor, patient, or concerned family member or friend. The goal of these shows is to bring awareness of the importance of taking care of our spine and the impact it has on our health and the hundreds of different health conditions it could cause without us realizing it. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support. Now on to the show. Okay, welcome everyone to the Chiropractic Deep Dive podcast and the Chiropractic Research Show. This is episode number 2 and the second show of our series to start off the show on chiropractic and stroke. This is a very misunderstood stigma in regards to chiropractic care and most likely limits thousands, if not tens of thousands of people from getting quality chiropractic care that could be literally life-changing. So make sure you find the playlist of all the shows in this series if you're interested in being completely informed. If you enjoy this episode and find it valuable, please hit that like button and subscribe. It helps others on YouTube find this video. And if you know someone who could benefit from the information, please share it with them. We would both be grateful. I'm Dr. Kevin Leach, and I'm here once again with Dr. Tyler Evans. How are you, sir?
I'm doing well. Good to see you.
Good to see you. Good to see you. This episode's research review is titled Risk of Vertebrobasilar Stroke and Chiropractic Care by Cassidy et al., published in Spine in 2008. Dr. Evans, before we dig deep into the paper, what is the main takeaway from this paper? What do people need to know?
I think the number one thing to take away is that there is not an increased excess risk of Vba stroke from chiropractic care. And second, that risk is the same or less than attending a primary care physician's visit.
Right.
And it's like there's cause and there's correlation. This is a correlation, not a cause. At least what this study found. And it's like, he comes out and says straight up, like, number one, the thing that we found is that there is a risk of VBA stroke from attending chiropractic. However, like he said, I can't remember exactly, I want to say that exactly how he says it, but It's not increased or excess. And it's like, then he says, we do need to go in and study, the risk of these cases, like specific cases, because this is a big data draw, right? So they didn't take like, oh, this person went to a chiropractor and we think that this person, the chiropractor got sued and this person, had a stroke from the chiropractic neck adjustment. It's just all these people, did they see a chiropractor? Did they not see a chiropractor? Large numbers chopped up to see, how many people see a chiropractor and then have VBA strokes.
But this was in response to the Rothwell study in 2001, where the researchers just looked at an association and the media and the public looked at it as causation, but what they looked at was there was an increased risk for patients to have a vertebrobasilar stroke from seeing a chiropractor compared to someone who didn't see a chiropractor. Now, what she didn't ask, and what the Rothwell study didn't ask, was if that patient also went for a walk that day or did anything else. They didn't compare it to, well, what if that patient went to a primary care provider that day or 7 days prior or 30 days prior. And so what Cassidy did with this study was took the exact same data set, the exact same research from the Rothwell study, same researchers, same doctors, same medical doctors, and looked at what were the chances of those patients having a stroke from seeing a primary medical doctor, and they saw that it was exactly the same. So what that indicates and what that implies is, what it suggests is a patient's already dissecting, they're already having, they're in the prodromal phase of a stroke, they're being symptomatic, they're seeking care. They seek care from a chiropractor, or they seek care from a primary care doctor who's not adjusting the neck, and they go on to stroke at the same rate. And it's because it has nothing to do with the treatment at the primary care doctor's office or the chiropractor's office.
Mm-hmm.
So what they found with this study was, hey, yeah, there is an association, that's an increased risk, but that risk is because those patients are already going to have a stroke, they seek medical care, and then they go on to have the stroke, and a primary care doctor nor a chiropractor is going to prevent that or cause it.
Right.
So that's the huge thing there. But the problem and the stigma with patients being getting a stroke from a chiropractor is because of the thrust on the neck. So they say, oh, you went to a chiropractor, now you're having a stroke. So they just assume it and say that's the cause, instead of actually looking into, is that really the cause, or were they actually having a stroke? I think that's the biggest part, and that's the biggest takeaway from this study.
And I agree. And I pulled up, I can't remember where I found this data. I mean, this is on just on Google. You can pull this up, but it put the risk into perspective. It talks about, general population without manipulation is 2 in 100,000 strokes per vertebral artery dissection, to be specific, per year. With manipulation is 1 in 5.8 million treatment sessions that there is an association. And then below that, it says, actually, this is fascinating. These statistics are fascinating. It says stroke of risk with chiropractic care is 0.00000017. Stroke risk without chiropractic care, somehow they came up with that statistic, 0.00002. So it's like a smaller number. And then lumbar spine surgery, the death rate is 7 in 10,000. Death rate from lumbar spine surgery. 2-month and then a 2-month course of NSAIDs, risk of death is 1 in 1,200. And then the death rate for acetaminophen, this blew my mind, Tylenol, acetaminophen is 1 in 2 million tablets. So it's like, well, let's put this in perspective. It's just about perspective, right? And you've probably seen this book called Lying with Statistics. Like, it's just the way you chop the statistics up and look at them. It's all about context, and not saying that people are, out there trying to do this, but it needs to be put in perspective. Like you're saying, there's an association, not a causation, and that's what we're discussing.
Absolutely. And I'm going to put the link to the Dr. Clum video that I told you about. He goes through all the studies we're going to go through. He goes through all of the mechanisms that were proposed that chiropractic could potentially cause a stroke. We're going to hit that all into detail. There's a couple points that I think that are important that to kind of differentiate, especially with the kind of stroke that we're talking about, and how they, just how frequent they are. And I think with so it's the vertebrobasilar artery stroke, right, compared to the carotid, and both of those are the cerebral arteries, right? The vertebral artery is what produces about 20% of the blood flow into the back of the head, and then the carotid's about 80%, I think it is. And
well, the carotid actually supplies the brain, and the vertebral artery supplies the brain stem.
Right. And 10 of the 12 cranial nerves.
Yes,
which is
right.
super important.
Which is why you have visual problems. So that's kind of how you can tell the difference is carotid artery stroke, you'll have like language will be a problem because it's the deep center of the brain. It's up in here, versus a vertebral artery stroke, you have, eye drooping, and you have, vision issues, things like hearing, things like that.
Right. And the interesting thing that they found, I'm not sure if they knew this before the study or not, but they found that the VBA type of strokes were 1 in 230. So it's less than 0.5% of strokes, of all strokes.
Yes, of all strokes.
Of all strokes are vertebral basilar artery. However, vertebral basilar artery strokes are 1 in 4% of people less than 45 years old.
Right.
Which is again interesting. It's almost like after age 45 you get another protective mechanism of for some degree, but I'm not sure if they go into the detail of why that is.
Well, I think it has a lot to do with younger people. Smoking and birth control is a big part of that.
Interesting.
And medications and things like that. So
okay, yeah. Maybe we'll get into a little bit more of that as well. So how about the what makes this study huge as far as like legitimate? The size, the type of study it was a case control, case crossover, population based study. There was 109 million person years, right, in a span of over, I think, 9 years of healthcare provided in Ontario. Was it Ontario?
Yeah.
So it was a massive study. And again, population based. So they took these patients from a massive, pot, we could say, instead of just hand picking and saying what happened with this individual patient. It wasn't like a case study or something.
Right.
So that's what makes it a legitimate and very, very important and strong, robust study, right?
Right.
Any other details with that?
Yeah, just that it ran from 93 to 2002. That was the time frame in which it happened, and they were pulling from the Ontario health insurance plan data. So they actually just took it from the data and chopped it up from there.
Cool. Any other details as far as just kind of what, from this, did you want to review anything or talk about anything as far as the study goes?
Well, I think, it's always good to talk about the strengths and limitations.
Okay.
So, we talked about the strengths there. A major limitation of utilizing health administrative data, is just that they were talking about some misclassification stuff. So basically there's a little bit of issue with the reliability and validity of the coding of just the way people are entered into the system. And I think that the way that really ends up affecting things is just what intervention they were given and what their problem was. So a lot of times people might be diabetic, or they might have other comorbidities that are going on. It's kind of like COVID, right? So there's a lot of comorbidities. And if you aren't talking about the fact that the person is a smoker and taking birth control, and they're under the age of whatever it was, 45, that's a big red flag and a warning. So a lot of times people don't put in that they're smoking, right? Because they don't think like, oh, the doctor needs to know this. And that's a big indicator for these problems. And it's something that chiropractors need to talk with their patients about too. And so that's on the chiropractor too, is to be aware of those issues. So just some limitations of it.
Awesome. All right. Well, thanks everyone for tuning in. Again, this is going to be a series that we're doing. It's episode number 2 of many of the papers that we're going to go through in regards to support in the literature on the safety of chiropractic care and the lack of evidence that chiropractors are causing strokes out there. Again, it's impossible to say that it's absolutely not happening. But it's with a lot of the research that is out, it really suggests that it's not happening with healthy arteries and healthy blood vessels. So we'll get into a little bit more of that in the other shows here. But that's all for now. Again, like, subscribe, share with people that you think might benefit from it. Thank you very much, sir. We'll talk to you next time.
Awesome.
Awesome. Take care. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.